Hello, I'm Taniqua Broughton with the State of Black Arizona.
And I'm Shadi Tofik with March of Dimes.
The State of Black Arizona and March of Dimes have come together to launch this awareness campaign on Black maternal infant health in Arizona.
March of Dimes convenes the National Mom and Baby Action Network. We are dedicated to leading and facilitating change across policy, research, funding, and systems to promote health equity and improving the birthing experience for Black mothers.
By adopting the Mom and Baby Action Network's National Health Equity Framework, we aim to engage Black stakeholders and the community at large, establishing a common agenda and calling on Arizonans to take positive action for change. We like to express our heartfelt gratitude to our major sponsors, Arizona Complete Health and Blue Cross Blue Shield, and to those who generously funded and/or actively engaged in bringing this project to fruition. Your unwavering support is not only invaluable, but also instrumental in ensuring the success of our mission.
Please be sure to watch each video until the end for links and resources where you can contribute and take action. Your involvement makes all the difference. Together, we can achieve what we cannot achieve alone. Thank you.
Isabel Wilkerson wrote a phenomenal book called Cast. She makes the analogy of an old house. You've inherited an old house. You didn't build a house. You weren't even there 50 years ago when no one repaired the roof or the crack developed in the foundation or the pipes burst in the walls. But now it's your house, and it's for us to work on fixing it.
There is definitely unequal treatment for Black women and mothers in maternal health. What we know from diving into the literature is that Black women are not receiving adequate care in maternal health care settings.
Oftentimes we hear they're presenting to the hospital and they're not being listened to. We're seeing that they're dying 2 to 3 times that of their white female counterparts when it comes to pregnancy.
America is number 34 on infant and child mortality in the world. If you're an African American in America and you're a country, you would be down near 70th. We die twice as often as everybody else in America. Watch this though. If you're an African American and you're taken care of by an African American doctor, you'd be the 15th country in the world. Now, why would that be the case? It is attention to detail.
There's racism still to this day in the United States. We know that it's a systemic racism, the racism that oftentimes can be in the form of implicit bias or unconscious bias.
Coming from doctors, they're coming from nurses, people that are supposed to be taking care of our Black women.
As an example, many people have thought that the pain threshold for Black people, Black women in particular, was much higher.
Your pain is not as significant as you think it is. Your cramping is not as significant as you think it is. And be sent home only to deliver precipitously in the car. That happens more than you think it does. It happens a lot.
A lot of folks will be in denial and say, well, we don't have a problem here. That's actually one of the ways that racism operates. You deny. They put their data in front of the clinicians at their hospital and immediately they close the gap. Once people said, oh my God, are we doing that here? They started to listen differently.
We have to be aware of the fact that certain populations may require more closer monitoring than other populations.
Researchers can take that and they can turn it into something greater. They can turn it into training programs that they can test and see, does this improve outcomes for Black women?
With regards to race, we've tried and tried and tried. And what we have to do is legislate all the things that we want to get done.
Healthcare in this country should be unrelated to your employment or your economics. And it should focus on health, not selling medical services.
We have to listen to these women. We have to also educate these women on how to self-advocate for themselves. They are at the greatest risk largely because of racism. We have to become more comfortable in having these conversations so then we begin to believe these women.